6 slides today is to the purpose of this presentation today is to apprise you of COVID immunity. First of all, how do we get it? How we have got it, either after an infection or after a vaccination. So the question remains, how long does that last? And that is what we will put before you in a scientific perspective. Now we know the whole virus SARS-CoV infects an individual in natural settings. This virus elicits three kinds of responses. One is antibody-mediated, the second is cell-mediated immunity, and then there is immunological memory. And measurement of antibody titer alone does not capture the entire protection. So that is very clear. However, it is well known, and we will be talking about some of that data, the durability of immunity post-infection persists for about 9 months. So if you get an infection for 9 months, you are generally protected. And what is the evidence? The evidence is the following, and this is global evidence. Immunological memory for SARS-CoV lasts for more than 8 months after natural infection. This is from USA, published in Science. Then there is antibody and cellular response more than 9 months after infection from China. Then longitudinal investigations in USA of multiple studies have shown that the antibody responses persist for more than 13 months post-infection. And the systematic review of 10 studies from Israel, England, Denmark, USA, Austria, and Italy have that more than 90% reduction in reinfection up to 10 months. So you're protected for up to 10 months. That is 8 to 10 months, 8 to 13 months, that is the general. So that is why we like to say that up to 9 months and take a slightly conservative estimate of that. And that is, what is the evidence from India? There are 3 studies, 2 from ICMR and 1 from Bombay, on 284 patients, on 755 patients, and 244, that it persists for up to 8 months, 7 months, and 6 months. And these are all published data from infection that occurred in 2020, 2021, and that has been followed up for 8 to 9 months, and that is where we stand. So 90% is at least up to 8 months. Now this is the immunity that I talked about, provided by a natural infection, lasting up to 8 to 13 months, and most probably, so we've taken a conservative of 9 months. Then vaccination can provide immunity, and majority of Indians have received either of the 2 vaccines. And we know the 2 vaccines, we will talk about them. Some vaccinated individuals had prior symptomatic infection, and some vaccinated individuals had prior asymptomatic infection. That is why if you look at the seroprevalence, that was 67% in June, July, and in Delhi they'd come up to about 90%. So some of them were asymptomatic. So in essence, what is the summary of this point I want to emphasize is that multiple exposure to the virus antigen has happened, whether it be through the vaccine or through infection or through contact. And the durability of this immunity also persists for up to or more than 9 months. And what is the evidence that we have, scientific evidence, for this immunity to persist for up to 9 months? There are global and Indian evidence. So there is a meta-regression analysis on 4 WHO emergency licensed vaccines, and one of them was AstraZeneca vaccine, that more than 90% against severe disease for more than 6 months in all ages across the board. This was a huge meta-regression. And other important point is recovered and vaccinated, that is hybrid immunity, that is people who have recovered after an infection and have been vaccinated, or vaccinated and then also had disease and recovered. So that is called hybrid immunity. And those promotes a slightly stronger response and lasts slightly longer. And this robust antibody titers after second dose may be more than 6 months. That is published in a very important journal called the Nature. Now, what is the evidence from India? So we have 3 studies, and there are a few more. I've just taken out the 3 key ones. One is from Calcutta, the other is from Kerala, and the third is from Chennai. And they have looked at presence of persistence of cell-mediated immunity is 10 months, both Covishield and Covaxin. This is from Calcutta, after a vaccination alone. We do not know the infection status, whether they got asymptomatic, but what is the duration of persistence of cell-mediated immunity in vaccinated individuals is up to 10 months with both, either with Covishield or with Covaxin, and this is a large study. The other is hybrid immunity with Covishield is stronger than only infection or vaccination. So if you have had an infection and a vaccination, your immune response is more than only infection or only vaccination. So important thing is that vaccination is absolutely essential. And this is another study from Chennai, which is on healthcare workers, that more than 70% of 116, good concentration of both anti-S antibody and neutralizing antibody for more than 6 months following vaccination. So now coming to the vaccines that are being used in India. We know that there are 2 vaccines which are the main players of. One is the whole virion killed vaccine with an innovative adjuvant, that is the Covaxin. And the second is a viral vector-based subunit vaccine, that is Covishield. So, and vaccine recipients are vulnerable due to intense transmission dynamics. So the transmission dynamics expected, what we are seeing in USA or in Europe, are intense. And our 1-dose coverage is 90%. And 2-dose coverage, I should stand corrected, is 63%. So that is also, that has happened as far as India is concerned. So this much vaccination has happened. We know the number of cases, we know the seroprevalence, that is also to be factored in. And the third point is that the transmission of Omicron is 3 times or 4 times more than the Delta variant also. So that will also be exposing people for this. So next. So my last slide is, in terms of the precautionary dose, we have to remember one important point, and that is the most important point, is that all COVID vaccines, whether it be from India, from Israel, from USA, from Europe, from UK, or China, all these vaccines are primarily disease modifying. They do not prevent infection. So they are not infection preventing. So precautionary dose is primarily to mitigate the following 3 things. 1, severity of infections. 2, hospitalization and death. Now this is very important for individuals who are elderly, immune compromised, on chemotherapy, or patients of chronic obstructive lung disease. So these are patients where a precautionary dose would be useful to prevent the 3 serious disease, hospitalization and death. And the important 3 points that I want to stress on is mask use before and after vaccination is must. Mass gathering should be avoided before and after vaccination. And earlier and currently circulating strains spread through the same route. They are all spreading through the respiratory tract, through the airborne. So we have to remember that whether the virus is mutating, it spreads by the same route. And last and the most important point, which has already been emphasized by Srilava Agarwalji, is that the treatment guidelines for the earlier and the current circulating strains remains same. The treatment does not change, it remains the same. Home isolation remains an important parameter, important pillar, and hospitalization will be limited to those, particularly those who are unvaccinated. Those who are unvaccinated will be the ones who will be admitted to hospitals. People who are immunocompromised and chemotherapy will be the ones who will be admitted to hospitals and will require more care. So I will stop here. Thank you.